In this video, let's talk on semi-solid dosage forms. In the earlier videos, we've talked about solid dosage forms, liquids, and the other forms of drugs, or we call them semi-solids, like the ointments, like creams, like the gels, like the pastes, you see. So generally, these medicines are a bit thick in terms of consistency, and they are basically designed to be applied on the skin or to the mucous membrane of the different body cavities. Maybe we could apply them as eye ointment for the eye, or maybe you have a nasal, or maybe rectal ointment based on the different types of the body cavity. So the reason behind is that you see some drugs work best when you apply them directly when where the problem is, instead of swallowing. For example, if you have a skin fungal infection, the first better option could be to apply a fungal ointment before you're given an antifungal tablet or an injection. So you try to tackle the problem where it is. That is basically what we call a local action. So to get a local effect from medicine, semi-solid dosage forms, especially for topical infections, or for disorders affecting the mucous membrane, they are very better ones. In the next video, I'll talk about each of the ointments, the creams, the pastes, and stay tuned. Let's see ointments. I don't know which ointment are you having at home. I'm not talking about the cosmetic ointments. Yeah, there are also ointments. We call them non-medicated, but we also have quite a number of ointments. We have antifungal ointments. We have steroidal ointments for treating dermatitis, eczema, and others. We also have ointments for different fungal bacterial infection. Okay, so the key point in using your ointment is to wash your hand before applying, and when you apply, try to apply a very thin layer at the recommended dose and at the right or affected area. That is a very important part of applying the ointment. And there's also a practice of sharing your medicated ointment with people who live around, with friends. That is also a bad practice. People usually think that it is only the oral antibiotics that should not be shared or that will have microbial resistance. But remember, still, fungal ointments can also end up in failing if you don't use the correct amount for the correct duration. The same is true for steroidal ointments, the same like the steroid tablets. You should follow a certain dosing mechanism. For example, steroids, because of their toxicity, you need really to taper down the dose slowly to reduce flare-up of some of the topical conditions you have. So if you try to use maybe your steroid ointment today, tomorrow, and then if you just stop it, then maybe the eczema reactions or the atopic dermatitis might relapse like as it has never been. So for that, again, it's very important to follow the instruction given when it comes to the correct modality of applying your ointment. Okay, don't think as if it's only the tablets or the injections that you should be taking them correctly. Some people take, for example, antifungal ointments and they'll take it just for 1 or 2 days and they'll just stop. Then again, they'll come back again saying that, oh, still my fungal infection is still there. I'm not getting a good response. So what is the home take message? So the same care we do give for topical, for oral, or for other medications, the same, these ointments, creams need a due attention, especially when they are treating an illness. Ointments. See you in the next video on creams. Let's talk about creams and what is really a cream. Okay, a cream is one of the semi-solid dosage forms, and basically they are made from oil and water. Unlike ointments, they are not a bit greasy. You feel lighter when you apply creams, and they can spread easily, and you feel more comfortable, especially for everyday use, even whether you apply them on the skin or on an area where there is also hair. They are not too much sticky. We can have different types of cream preparations to treat skin infections, to reduce inflammatory conditions, itching, and most of the cosmetic creams also will have a benefit to moisturize the skin. That is why they are so ideal, as I said, for skin conditions and also for applying on hairy areas. You can have antifungal creams, for example, to treat fungal infections of the skin, the foot. Okay, we can have steroid creams, for example, antibiotic creams, moisturizing creams. Basically, the goal, with the basic thing between ointment and cream, the commonality is them providing you a local effect at the site of administration. Creams are very good. I don't know what type of cream you are really taking at this time, or which of the creams have you ever had, and have you ever had any problem in taking creams? I would love to hear your experience, but these are very important products. Sometimes it's very important to choose the right product, the right ointment, the right cream for your skin type. And if you ever had any allergy, any problem in taking ointment, in taking creams, it's good to say it before your doctor prescribes that ointment or cream. I'm not talking about the cosmetic creams here, but for those medicated ointments and creams, it's very important to look at any adverse effect, whether it is itching, allergic reactions, okay, or redness in the area you applied, or difficulty of breathing for that matter. You need to report that quickly. See you in the next video.